Hi, my name is Brian Gonzalez, and this is Anatomy and Physiology. I'm going to explain the appendicular skeleton. So pretty much the human skeleton is split into two main parts: the axial skeleton and the appendicular skeleton. For the axial skeleton, the gonna form like pretty much the upper part of the body, like it's going to be the skull, which protects the brain. It's going to be the vertebrae column, like pretty much just the long back of the spine, and the rib cage. I have my non-labeled images here. So pretty much for the axial skeleton, it's going to consist of the skull. Here's the front and the back of the skull, and then the next one's going to be the spine. So pretty much this long, narrow, skinny, um, long part of the bone. It's going to be the spine. And then also the rib cage. So pretty much as you see, it's almost like heart shaped, I guess. But here's the front part and the back part. They look exactly the same. So that's going to be part of the axial skeleton. For the appendicular skeleton, that's pretty much going to be part of like the shoulder girdle, like the clavicle. The clavicle is pretty much just like the collarbone. So as you see here, just these two long bones as you're gonna feel right there. And then it's gonna be the upper limbs, pretty much like the humerus, radius, ulna. The phalange is gonna be like the fingertips, as you can see here, the bones of the fingers, and the lower limbs, pretty much the femur, patella, tibia, fibula, pretty much like the ankles, the foot, and the phalanges are going to be the toes. It's pretty much just the lower half of the body that you're going to see on the diagram. So this is my non-labeled diagram, and then I'm going to kind of go over some of the bones. I'm not sure if I'm supposed to like describe all of them, but for the anterior skull, it's pretty much going to be like the nasal, the sphenoid, lacriminal, ethmoid, zyopathic, I see, maxilla, mandible, frontal, and frontier. Those are pretty much just going to be the anterior of the skull. The posterior of the skull, which is the back area, as you see here, that one's going to be the mandible, occipital, patella, and temporal. For the lateral skull, like the side, it's going to be the emploid, temporal, lateral, mandible, maxilla, the nasal, occipital, patellar, temporal, and zygomatic. The inferior of the skull, the inside, is going to be the empathoid, frontal, ocular, patella, sphenoid, and temporal. The vertebral column is going to be the atlantis, axis, um, cervical vertebrae, the back area, the coccyx, the lumbar vertebrae is going to be the lower end of it, the sacrum, thoracic vertebrae, the thoracic cage would be the body of the sternum, false ribs, floating ribs. As you see here, the floating ribs are going to be the ones that aren't attached, the mandible of the sternum, and then the true ribs. The appendicular skeleton is going to be the clavicle, the humerus, radius, scapula, and ulna. The hand and wrist are going to be the capitate, hamitate, lunate, and then the scaphoid, sigmoid, and trapezium. Um, the metacarpal, the phalanges is going to be like the fingers, the the trapezoid, and um, trapezium, I think it's called. The pelvic girdle and lower limbs are going to be the limb, the ischium, I don't know how to say that one. The pubic bone, femur, patella, tibia, and fibula. Ankle and foot is just going to consist of the canalius, cuboid, intermediate, cuneiform, lateral cuneiform, medial cuneiform, metatarsal, navicular, phalange, and talus. So those are going to be my non-labeled images, and I hope that I covered all of the bones. So some of the bone diseases would be osteoporosis. It's pretty much a disease where the bones and the density becomes more weak and fragile, so that can consist of like getting holes in the bones, which could just decrease like the bone mass the weaker the bone feels. It's easier for it to break if they fall in an accident. You'll feel back pain, loss of height due to like spine compression. It's just gonna shrinkage that, and it's gonna make it harder to move a lot more. So your bones are just gonna be more stiffer and weak. So that's it for my presentation. Thank you.